With the COVID vaccination drive in full swing, we've been getting quite a few questions from my patients, friends, family. I'm Dr. Spoorthi and I'm going to try and answer some of these questions. I'm going to try and simplify it down, of course with scientific evidence backing it, but let me try and see if I can answer some of your questions. So some of the more frequent questions, and I've really chosen ones that I think are going to be useful for everybody. So the very first question and the very basic question, should I get vaccinated? An absolute definite yes. The vaccinations are not just to keep you safe, but also your community safe. It's very important that we attain 70% herd immunity. That is, at least 70% of the population becomes immune to the COVID virus. This actually helps prevent transmission of the virus. So this is very important for us. And contrary to all the different stories that you're hearing, these vaccines are pretty safe. So go for it. The next question is, can I still get infected from the virus after I've taken my 2 doses of vaccination? So the whole goal of these vaccinations is that we build a strong immune response to the virus. So even after the 2 doses of the vaccine, if you get exposed to the virus, you could still get a mild infection, but the whole idea is that your body has better ability to fight off this infection. Now, at the time of vaccination or before you have developed a proper immune response to the vaccine, if you are exposed to the virus, then yes, you can contract the infection at that time. That's called the window period, right? Also do remember that in spite of all our best intentions, the COVID virus does keep mutating fast, so there is always that little one question. That takes us to the next question, right? What many people have been asking me is, the virus is constantly mutating, so are these vaccines really useful? I think time is going to tell us that, but what we are really depending upon is, say for example, you take the flu virus, very similar to the COVID virus, it does mutate, and the flu vaccine that we give is based on last year's flu virus. So we have also noted that the flu vaccine is pretty effective. Now sometimes it is only partially effective, so I think time will kind of tell us how effective these vaccines are, but they will definitely be effective to a large extent. Will the COVID vaccine alter my DNA? No, it will not alter your DNA, and do not get confused when you hear that some of the vaccines are based on the messenger RNA, etc. Don't worry about it. It does not really do anything to your DNA. Will the COVID vaccine affect my ability to have a baby in the future? No, please do not worry about these things. It does not cause infertility or anything of that sort. Can I get the COVID infection from the vaccine? Actually, no, you cannot get an active infection from the vaccine. Vaccines are usually either dead virus or what we call live attenuated virus. That means that the virus is inactivated. So it is almost impossible to get an active infection from a virus. Okay, the vaccines actually help to build a strong immune response to fight off the infection. Will I test positive for COVID-19 after I get vaccinated? We've been hearing this quite a lot. People are testing positive for COVID-19 after they get vaccinated. I think that's because of a slight confusion there in terminologies. Now the COVID PCR test is the test typically used to look for active infection, and the COVID PCR test will typically not become positive just because you've had the vaccination. However, a person who becomes immune will develop COVID antibodies. So if you're checking COVID antibodies, they will turn positive. I mean, the whole idea of vaccination is to get your COVID antibodies to become positive. So I think that is where the confusion there, people are getting confused between a COVID PCR test and a COVID antibody, and then wondering, okay, the COVID antibodies are positive, so am I testing positive for COVID? So I hope that has been clarified. Should I check for COVID antibodies after getting vaccinated to see if I have built an appropriate immune response? It's actually not recommended at this time. We're not recommending that everybody check their COVID antibodies to make sure they're immune, but this is definitely something that is going to depend on each patient. So on a case-by-case situation, I think this is something that you should be discussing with your physician. Who gets higher priority in getting vaccinated in the first round? We have seen that people more than 60 years old, our senior citizens are probably the first people to get vaccinated, because their immune systems are a little bit slower, and so we really want to be able to protect this community, this group of patients. Also patients who have what we call comorbid conditions, that is, diabetes, blood pressure, heart problems, any of these, again in order to strengthen their immune response to the COVID infection. Now, so far, pregnant women and children under 16 have not been recommended to be vaccinated, so we need to really wait for more evidence before we vaccinate these groups. Next question, this is actually a very common question. Can I take my medications on the day of vaccination, or are there any interactions between the medications I'm taking and the vaccinations? Actually, even prior to COVID vaccination, adult vaccination is actually a huge part of healthcare, which unfortunately in our country is just not done as well and as robustly as it should be done. So typically the medications you take will not contraindicate the vaccination. So diabetes medication, blood pressure medication, heart medication, all these can be taken on the day of your vaccination and typically will not have any contraindication with the vaccination itself. A specific note, even blood thinners, antiplatelet or anticoagulant medications are not considered a contraindication for the COVID vaccination. Which vaccine should I choose? So India currently has 2 vaccines available, the Covishield and the Covaxin. Unfortunately, you won't be allowed to choose because most of the hospitals are being provided by Covishield, at least in Tamil Nadu. Only our general hospital, the GH, has Covaxin to the best of my knowledge. But again, both of them are relatively safe, so I really don't think you should have to worry about that. What are the side effects? Side effects are very typical to any immunization. There can be pain in the local area. You could develop a low-grade fever, maybe feel tired, maybe have body aches, etc. And these are again very typical to most vaccinations, and these are actually signs that you're building protection, you're building immunity against the virus. So it's basically your body fighting off this dead or inactivated virus. So that is actually a good sign. Can I just get 1 dose? Is 1 dose enough? Research studies have shown that about 90 to 95% immunity is obtained after 2 doses of the vaccine. So getting 2 vaccines at the 4 to 6 week interval period is recommended. However, new studies recently have shown that an 8 to 12 weeks could be better for building immunity. We are yet to get a consensus on that from Government of India. I have had the COVID infection. Should I get the vaccine? Short answer is yes, but it's going to differ a little bit. So patients who have already had the COVID infection have already developed an innate immunity towards the infection. So that is, they have already built this natural immunity towards the COVID vaccines, COVID virus. So the question is, so if I've already built it, then why should I get the vaccine again? Now we have also noticed that the immunity that is being built towards the COVID infection is actually short term. Most recent studies have shown that these antibodies seem to last in us for about 6 to 8 months, maybe longer, but we don't know that yet. So the vaccination is a way to boost the immunity. So typically what we are recommending, that if you've had the COVID infection say 6 to 8 months back, then this is kind of the best time to get your first dose of the vaccine. And it really acts like a booster dose, and it helps to remind the body of the COVID infection, and so the body builds another immune response very similar to when you had with the infection. Now people who had an active infection may not need the second vaccine. I think this also will help with the shortage of vaccines that we've been having here, and will also help with the logistics and the cost and everything. But patients with diabetes who just have like a slower immune response, or people who have had very mild or asymptomatic infection, these groups of patients will actually benefit from getting both vaccines, both doses of the vaccine, in order to get a strong immune response. If you have had active infection in the past 1 to 2 weeks, then do give it at least a 2-week period before you get vaccinated, because remember, you're still infectious during this time. So stay at home and stay quarantined. One more question here, probably not very common for most people, but I thought I would just kind of touch base on that. If you were treated with the convalescent plasma or monoclonal antibodies, then it's better to wait for 90 days before you get the vaccination. Definitely talk to your doctor as to what treatment you have had for the COVID virus infection before you proceed with the vaccination. The next question, how long after the second COVID vaccine are we going to be immune? We've seen that 90 to 95% immunity is built within the first 1 to 2 weeks after the second vaccine dose. So this is kind of the time period we are looking at. Now, in spite of all this, remember that the virus is still mutating. We have seen some really infectious mutated viruses in UK and South Africa. So the norm of hand hygiene, wearing masks, continuing social distancing is extremely important. Let us not think that the vaccine is here to protect us all and we can kind of avoid these few rules. I think these rules are here to stay for the near future. So good luck with the vaccination, and I hope I have been able to convince you that this is the right way to go. So let us make India proud. Thank you.